9:46 this morning. There is a free community education event happening this afternoon that deals with neck and oral cancers, specifically the link between them and human papillomavirus, or HPV. It's something that you might not think has a relationship, but it's there. So we have doctors from Hartford Hospital and Memorial Sloan Kettering in New York. They're going to be hosting that event together. I have one of the speakers today, Dr. Andrew Salner, certainly no stranger to the show. Good to see you again, Doctor.
Nice to see you, too.
Glad to have you here. Yeah, this is probably something that people don't know a lot about. They don't know a lot about head and neck cancers and oral cancers or HPV. So why don't you just give us the real basics on the association?
Well, head and neck cancer in the past has really been attributed more to alcohol and tobacco use.
Yeah.
And with the decreasing prevalence of tobacco in our society and the increasing prevalence of HPV virus amongst people between the ages of, say, 30 and 70, we're seeing a gradual increase in head and neck cancer, which is related to the HPV virus.
Okay.
The good news about that cancer is that it is quite curable.
Yeah.
The challenging thing is that the treatment is fairly aggressive.
Okay.
And that may leave patients with long-term effects of their radiation, surgery, or chemotherapy of their cancer therapy. And our research specifically is focused on how best we can support patients who've been through that kind of treatment.
So how can you? What are you going to say today?
Well, we know that some of the late effects that people can get when they get cancers of the tonsil and back of the tongue, those are the two most common HPV-related tumor sites. We know that 80 or 90% of those patients will be cured. With HPV, we're seeing many younger patients in their 50s and 60s who are getting this disease who don't have other medical issues. They're going to live a long time.
Yeah.
And they may have to deal with things like neck stiffness, difficulty swallowing, mouth dryness, dental decay, injury to the jawbone, issues with their thyroid gland. Those things don't happen in everybody, but they happen in enough patients so that we need to monitor them over time. The cancer team continues to follow these patients for a period of time, but our research specifically is on how to deliver a survivorship care plan, sort of a roadmap, if you will, for survivors for the next 10 or 20 or 30 years, how they can monitor themselves and also how they can stay well. It's not just also arming the patient, but it's also alerting their primary care physician who's going to be caring for them as to what to look for as well.
Does it make it especially hard with people who have those types of cancers relative to people who have other types of cancer?
Yes, those patients have a specific set of late effects that are not generally prevalent with other kinds of cancer types. Like each cancer type has late effects that we have to deal with. If it's breast cancer, it might be arm mobility. If it's prostate cancer, it may be issues with bladder or rectal function or erectile function. But in head and neck cancer patients, it really relates to how we swallow, how our neck is mobile, how our arteries are working in our neck. Okay. So there are a whole set of issues that are unique to that group of patients.
Well, can you talk in a very general sense about HPV? I think it's much more common in people than they realize. I think most people, just the layman's interpretation is that it's one of those sexually transmitted problems, but I think it's not exclusively so, and it's very widespread. Is that right?
It is. About 45% of the adult population carries the HPV virus, Tim, and we don't know why. Certain patients get HPV-related cancers, which can be of the cervix or the anal area or of the head and neck area. But we do know that catching those cancers early helps to treat them effectively. And we also do know that young people up through age 26 getting the HPV vaccine prevents 95+% of these cancers. And only approximately 50% or 45% of girls and 30% of boys have been vaccinated. So we've got a lot of work to do in terms of really preventing these cancers from happening.
Yeah, because my understanding is that the vaccine's not going to necessarily help you if you have it, but it's something that is going to really prophylactically to try to prevent it.
We'd like to try and vaccinate young teens before they become sexually active.
And also HPV, I think we just look at it as one thing when really there's all sorts of different human papillomaviruses. The same same way we say cancer, but there's all sorts of cancers.
Correct. There's a lot of different strains of HPV, and some of them don't cause cancer. Some of them just cause warty growths on the skin.
Right.
Some of them cause nothing.
Yeah. Okay. So that's important. I know when we're talking about this, I don't want all of you to think if you know you have an HPV infection or if you have some warts somewhere that necessarily that means your risk for head and neck and oral cancers is higher. It's not necessarily the case. But these are the things you can get. And as Dr. Salner said, it is very much geared towards people who already have those types of cancers that have come from HPV, although the doctor from Memorial Sloan Kettering is going to talk about the link as well. So this could be invaluable for you if you fit that criteria. It's happening from 4 to 5 p.m. there, that information on your screen. Doctor, thank you so much for joining us today.
Tim, my pleasure.
Glad to have you here.